Magandang umaga team! It's good to know Wednesday. Our topic this week is the top 10 tips of the ICU monitor. Number 1. Admitting a patient. Under demographics, enter the patient's MRN in the patient ID box, then tap the Get His button. This will auto-populate all other patients' information. This can be done either at the bedside or at the central monitor. HIS stands for Hospital Information System. Number 2. Pressures pause. Prior to accessing the arterial line for bloods or zeroing, let's make it a habit to tap the Pressures pause button first on the right side of the screen. This will give us 2 minutes to access the line without generating inappropriate and disruptive alarms. Remember, with so many alarms in ICU, we can get desensitized to them, leading to longer response times or missing critical events. Number 3. ECG printing. Ensure that a 12-lead ECG is attached to the patient. Then tap the Show All ECG button on the right side of the screen. To help remember which button to press, it is the right button on the right side, labeled as Res ECG Report is the right button to press. Number 4. Pressure overlap. Sometimes we have lots of waveforms and parameter boxes. We should then utilize pressure overlap by tapping the Setup button on the right corner of the screen, and then change the pressure overlap option from off to individual. This overlaps the CBP, arterial line, and ICP waveforms, giving our screen more space and allowing us to view the components of the waveforms more closely. Number 5. Pressure scale. The ICU monitor defaults to a scale of 0 to 150 for arterial blood pressure. If the systolic exceeds 150, the waveform will shoot off the top of the screen, cutting the top of the waveform that is sometimes being misinterpreted as overshooting or an underdampened waveform. Tapping on the arterial blood pressure will open a setting screen where we can adjust the scale. Adjust the upper limit as per patient's blood pressure requirements. Number 6. Large mean. In ICU, we often target a specific map. Under General Settings, there is an option we can turn on called Large Mean. This will increase the font size of the map, making it easier to read and monitor at a distance. Number 7. ECG alarms. Sometimes our patient's movement can trigger various alarms such as a systole whilst climbing out of bed. This causes alarm fatigue and disturbance to all other patients in our care. Changing the leads view from 2 to 3 under the ECG settings will help resolve this issue. Number 8. Transport view. Need to go to scan with plenty of parameters to monitor? Tap the button view until brick is in view 3. Number 9. Zeroing the brick. Have you always wondered how to zero arterial line next to the bedside? Tap arterial, then this arterial setting will show up. Tap settings, then zero the arterial line. Number 10. Constant tone. If the brick is giving constant beeping noise, check that the source of heart rate tone is off. To do this, press heart rate, go to settings, then turn the tone volume off. Salamat!